Yeah. Namaste, everyone. Welcoming you all to the 15th holistic webinar. We conduct one webinar each month, one for holistic medical approaches to different diseases and conditions. The other one is psychological mind care webinar. So today our webinar is on mind body solutions for headache relief, a very common problem, isn't it? So we do hope that this webinar is for educational purposes and it is informative for you, and individual results will vary. So before you take up any treatment or medication, it is always mandatory to consider to consult a doctor. And I'm Dr. Preeti. I'm going to speak on headaches types and the science behind. So headache is a very common symptom. I would request the participants to put it in the chat box. How frequently you get headache? How frequently you get headaches? In the chat box, if you can put it in the chat box, how frequently? Thrice every week, approximately. Triti ji. Okay. Anyone else? How frequently you get headache? Twice a week, approximately. Okay. After we know about the types of headache, then we will come back to this same question weekly once. Sublakshmi ji. Yes, good. So we'll come back to the same question and find out what type of headache you have. Komal ji, twice a week. Thank you. Thank you. So headache. So headache, how will you describe a headache? So it's given here, pain or discomfort in the head, scalp or neck. So this is head, this is scalp or neck. It's a pain or discomfort. It is together, okay? But mainly head is here. So it's one of the most common of all human physical complaints and the easiest excuse we get, right? Anything we don't want to do, what excuse we will give? I got a headache. I want to rest. But is it so? Or is it really that at that time we get a headache? We have to see during the webinar. And headache is itself not a disease. In the medical terminology, it's a symptom. Symptom means it's the outward manifestation of a disease or a condition inside. It is the outward manifestation. It is what you perceive, the pain. So there's something more inside. Okay. So there are two major categories of headache. So two major categories. What are they? Primary and secondary. Okay. What are they? Primary and secondary. So primary means headache is not caused by any other disease or trauma. Headache alone is there. Okay. Headache alone is there. Then it's primary. And it is the major form of headache. So what I want to emphasize is, after going through this webinar, you should not think that if some headache is there, some major disease or problem is there in my body. No, that's only less than 2% of the headaches which they see in hospitals. Okay. The headache which we are mainly dealing is primary headache, which is caused by any other disease, trauma or medical condition. It is the major form of headache and accounts for 90% of the headache. It is due to the problem with the nervous system. It is due to problems with the nervous system. And most patients presenting with headache will have primary headache symptoms. And if it occurs once, then it's called that episodic. It occurs once or twice, as you said, in a week. But chronic headache means when the headache occurs more frequently than for 15 days per month for more than 6 months. 15 days, 15 days you get a headache, or for more than 6 months, you get at repeated same intervals. But secondary headaches are due to trauma. If you get a head injury or if you have a tumor, immediately when you have a headache, you should not go to that. We get this, we see in the movies, the moment headache is quite common, it might be a brain tumor. No. We'll have to find out what are the other symptoms which will occur in brain tumor that we are not going to see today. We are going to see only primary headache alone. Okay, so don't get panicky about it. But if you have other symptoms than what we are going to explain for the different types of headaches, then you should definitely consult. And when the headache is chronic, you should definitely consult a doctor. And neoplasms is again tumor. Substance abuse, which is drug abuse or drug withdrawal, infection, inflammation, metabolic disorders, all these can cause secondary headache. We are going to focus on primary headaches because that itself is a big thing. So there are different primary headache syndrome. We call it a syndrome when other than headache, there are other features like nausea, vomiting, okay, those things. That is called a syndrome. A group of symptoms is called a syndrome. Group of diseases is called a syndrome. So there's tension type headache, migraine, trigeminal neuralgia, cluster headache, all this I don't want to confuse. We are going to see 4 types of headache. How many types? 4 types. One is tension headache. The other is migraine. The third is sinus headache. The fourth is cluster headache. We'll see what it is. So tension type. So can anyone tell me from the name what could be tension headache? Or you can put it in the chat box. That is which is caused by wife or husband. Anybody? What is tension headache? That which is caused by family. Is that tension headache? What is tension headache? Monday morning headache. Yes. Stress. Correct. Okay. So tension headache means it is actually we tend to use the term tension when somebody gives us some stress or we are stressed. But actually the name for tension headache came because of muscle tension, which means we will have muscle, the neck and the head muscles being little bit stiff. We become stiff and that will be in the form of a headache. It is the primary type of headache seen. It is the main type of headache. What is the main type of headache? Tension headache. And it can occur both men and women equally. Because this is very important because certain types of headache are more common in each gender. Tension type is common to both men and women. Okay. So please you cannot tell that wife cannot get a headache or mother cannot get a headache, father cannot get a headache. Everybody can get a tension type headache. And it can be episodic, it can become chronic also. Okay. It is because of CNS nerve. The nerves are being stimulated. The nerves are getting pain. So what are the factors? Again, as you all said, stress. And usually, though it's Monday morning, it's not, you will not get the headache on Monday morning like a participant put. It will be more in the Monday afternoon. Okay. Usually occurs in the afternoon after long stressful work hours or after an exam. When you are deprived of sleep, when you are in a bad posture or uncomfortable, stressful position for a long time, irregular meal time, when you don't eat on time properly, eye strain, caffeine, when people have a habit of drinking coffee and they don't drink coffee, then they get tension headache. And dehydration. Dehydration is the primary major cause of headache these days. Okay. So when you are having a headache, make sure that you drink lots of water and you keep yourself hydrated. And symptoms and signs. How will you know it's tension headache? It will be like this band of pain, which is around your head from the front towards the occiput. Occiput means back. So it will be like a band. Always remember tension headache will be like a band of headache. Band of headache. Even like this or like this. It will be like a band. It will be bilateral both sides. Dull, tight band like pain, like something is pressing on you. That is how you will get the tension headache. It's less in the morning. It increases as days go on. There will not be any nausea, vomiting. If it is there, it is different type of headache. Okay. No nausea, no vomiting, no throbbing. Throbbing means something is pushing from inside. That type of pain you will not get in tension headache. No sensitivity to light, sound or movement. So if somebody is having tension headache, if some lights are there, some sounds are there, some movement is there, the headache will not increase. Okay, it will be the same level. Okay, it will be like that same dull pressing pain. That is the type of headache. So this is tension headache. No vomiting, no nausea. So what happens is when stressed, the muscles become tensed, the nerves become activated, the pain receptors are activated, which causes more stress and goes into a headache. So this is how you will get like a screw tightened with a band across. So this is how you will get a tension headache. Everybody there with me? All clear about tension headache? What is, ma'am, I get headache when I'm exposed to hot sun in summer. What about it? We'll come back to it. We'll come back to it. And after we finish the 4 types of headache, you yourself will be able to guess as to why you're getting the headache. Okay. So we are in tension headache. The next type of headache is, so okay, for management, again, painkillers. You can get on the counter painkillers, which you can use. But why you should not use, we will see in the webinar often. And we'll go with naturopathy and psychological remedies, which Neha Bhartwaj ma'am and Dr. Amanda ma'am will be speaking on. And this behavioral approach relaxation techniques for tension headache, which works splendidly well for tension headaches. The psychological relaxation and natural remedies can work very well for tension headaches. Next, this is migraine headache. In Tamil, they will say Otta Talavali. They'll say like one-sided headache. Okay. Usually it's one-sided. Usually migraine is one-sided, but it can be both sides also. But tension headache is full. Okay. So from the first and the second, this is the difference. And migraine is more common in women than men. Migraine is more common in women than men because of the estrogen hormone. So before their periods or before their menopause or before they're getting the puberty, those times this headache can increase and it will be throbbing pain. That was a dull pain, tension headache. Migraine pain will be severe, episodic. It will be like episodes. Now I'll be getting throbbing pain, then 10 minutes, and then again after that I'll be getting it. Nausea and vomiting may be there, which occurs mostly with people with migraine headache. There will be sensitivity to light, sound, and movement. If I have to get up from them, in my case, if I'm getting migraine, then I usually have, earlier when I got migraine, I used to feel that when I get up, the pain increases and sensitivity to light and sound will be there. So women, when they are having a migraine headache, if somebody else is shouting, then you will get more headache. Even men, but men also get migraine because it is genetic, but little lesser than women. Men have another type of headache, which we'll see in the webinar, which is more severe than migraine, and that is more common in men. And there is genetic predisposition. If either of the parents have had migraine, 50% chance is that the child will get migraine. If both the parents have, then 100% chance that you will get migraine. So migraine is like severe episodic unilateral throbbing pain. So there are different theories for migraine. Okay, what happens is, actually, there will be the blood vessels in the head first compress, then dilate. So this blood flow changes causes the throbbing pain. Then there will be muscle tension as well. But that in the previous headache, that was the major cause. Then there will be change in the hormone levels. There will be change in the hormone levels. And this is what it is. You should know about it because migraine is a very, very commonly misused word in terms of headache. If somebody gets a headache, immediately they jump to the conclusion that they get migraine. It may or may not be, but I want you to know the symptoms, okay? So there are 3 classic steps in when a migraine occurs. The first is called prodrome. Drome means storm. So what's prodrome mean? Can someone say prodrome means? What could prodrome be? Am I getting something in the chat box? Prodrome. What could prodrome be? Drome means storm. Storm means cyclone. Like, what is prodrome? Before the storm. Very good, Komalji. So, prodrome. So, migraine people, you will know before the migraine is going to start. Okay? Because the hypothalamus and the neural peptides, certain peptides which are involved in maintaining the balance of the body gets altered. So, you will know the symptoms before you get a migraine. The second step is aura. Classic migraine will always have something called aura. Aura means you will have blurring of vision, or auditory stimulus will be little different, or taste stimulus. You will have a metallic or some different taste, though you're not eating anything, okay? Particular to that. It is because of something called cortical spreading depression, which means the nerves across the cortex slowly, like a wave, no, like a blackout happens in the city. Slowly, those nerves will get depressed. Depressed means the nerves will get they'll be calmed down. calm down, which is bad. Okay, nerves should not be calmed down. They should be working properly, and there will be changes in the sodium potassium levels. All this happen, and then the headache will happen. Unilateral throbbing headache, sometimes bilateral. For certain people, migraine can be bilateral, but what differentiates is, okay, triggers we will see. Flashing lights. If you have a genetic high risk of migraine, over time, stress, fatigue, smoking, menstruation, pregnancy, menopause, sleep changes, caffeine, chocolate. Remember, chocolate can predispose certain people to migraine. Though chocolate can help relieve headache, in migraine, it may make it worse. Okay, so remember that. And even caffeine, for some people, for tension headache, caffeine will help relieve. Okay, but for in migraine, coffee may actually trigger migraine. Okay, for certain people, and there will be class. This is classical migraine with aura. There will be episodic. Paroxysmal means in sudden burst. Episodic headache, nausea and or vomiting will be there. Aura will be there in 25% of the people. So this is aura. If you see, you will have some blurring of vision, temporary visual differences, or olfactory smell differences, taste differences. It will be different for each person, because migraine is again a gray area. Nobody has done much perfect finding of this is how migraine will be there, but there will be silvery zigzag lines over a period of 20 minutes or so. This is aura. Will classically, people who have migraine, who have diagnosed with migraine properly, will, you can ask them, they will tell you, yeah, I'm getting the aura, I'm going to get a headache. They'll tell you. Okay, there may be without aura also, but vomiting may or may not be there. But paroxysmal headache, the throbbing unilateral headache, will be there. But for diagnosis of migraine, this is a simplified diagnosis. At least two of the following they should have: unilateral pain, throbbing pain, aggravation by movement, very moderate or severe intensity, plus nausea or vomiting, photophobia or phonophobia, sound or light phobia. Okay, sensitivity. So this is how migraine is. So when people tend to say they have migraine, please ask them, do you have these symptoms? Or when you think you're having a migraine, ask yourself, for these symptoms, because the treatment varies for each headache. For tension headache, you have to relieve the stress. You have to make sure that with painkiller it will go off. But migraine headache, the pain may be reduced with painkiller, but unless the factor which has triggered the migraine is taken off, that you should identify. When do you get a migraine? You should note it down. When you're getting a headache, after what you're getting the headache, then you have to rule out that factor. Then only migraine can be sorted. There are medications for migraine which works on the vascular system of the brain. The doctors will give you medicine which will help in balancing the vascular system, so that the migraine is prevented, and you should take the medicine once you get the symptoms of aura. You have to consult a doctor for it. So management, non-drug treatment is there for migraine, which is like avoiding the triggers. So if you suspect you are getting a migraine type headache, the throbbing headache, then please note down when you are getting a headache. You will notice a pattern, and you will have to avoid the triggers. And if for men who smoke, migraine is more. Okay, and for even men or women, if they are smoking, they should stop smoking. They should normalize sleeping and eating, exercise, relaxation and biofeedback, which Neha ma'am will be speaking, psychotherapy. All that will help in migraine, because it will help calm your system after the aura sets in, so that nerves become better. The ions, sodium, potassium ions become stable, and so you will not get the migraine headache. So now, and this is that. Then in terms of allopathy, there is treatment for migraine, which is abortive, means which you abort the migraine, which you prevent the migraine from happening. Okay, so this is what about migraine. So we have talked about the tension type headache and the migraine. Are you all there with me? So can someone tell me what is the classic difference between tension headache and migraine headache? You can unmute or you can put it in the chat box. How will you differentiate for people who say there is a headache, whether it's tension headache or migraine headache? Can someone tell in the chat box, or can unmute and tell? Between tension headache and migraine headache. Tension headache will be, where will it be? Okay, aura, very good. Tension headache, where will it be?
It will be like a band.
Yeah, it will be like a band, very good.
And migraine will be one side of the head.
Okay, and throbbing will be there in tension headache? Yes or no?
No.
Yes, very good. Nitin ji, Sudish ji, Subbulakshmi ji. Yes, thank you, thank you. So no throbbing. So now you all know about two types of headache: tension headache, migraine headache. Now we are going to the third type of headache, which is sinus headache. This is very, very common in India because of the tropical nature and and also the humidity in the air. Okay, other than pollution, which is like common everywhere in the world. But sinusitis, because sinus are these drainage places. There are empty spaces on the either side of the nose and this area. Okay, so this area and this area, you have certain spaces in your skull. Okay, in the skull bone, where there will be lined with mucus secreting cells. Mucus means that cold which comes out of that secreting cells. That will be a thin fluid will be secreted to keep the dust away, to bacteria away and all that. It will be secreted properly. But if there is an infection, or with constantly you have breathing issues and your pores get blocked, the sinus drainage gets blocked, then the mucus, and there's inflammation because of the infection, then the mucus will be secreted in a thick manner. It will get clogged there, and that will push the nerves and cause headache. So sinus headache classically will be in this portion, like a butterfly. Remember a butterfly and you will know it is a sinus headache. Okay, so these are the sinuses, these frontal, ethmoid, sinus, sphenoid and maxillary sinus. There will be obstructed sinus opening, inflammation, and there will be nasal, it will be accompanied with cold for some people, plugged nose for some people. Facial pain will be this typical butterfly shape in this place and this place, this place. Okay, there might be fever and there will be this headache. Okay, and pain, and this will also be dull and aching pain like a tension headache, but tension headache will be here only, it will not be here. Sometimes it will be mixed headache, which means sinus will also be there, tension will also be there. Okay, so that's okay. But if you know that this place is involved, then you should know your sinus is being affected. Okay, and there will be a post-nasal drip, which means behind the nose in your throat there will be a kind of a bittery fluid, which is like always you can feel that bittery cold type fluid, and fever may be there, headache may be throbbing or steady, maybe for hours or days, because it's related to infection. As long as you don't treat the infection or the cause of the blockage of the sinus, it may be a septal deviation, the mid of the nose being deviated, or breathing problems, or like asthma or inflammation, whichever is causing the sinus to be blocked. Till you remove it, you will have the headache. And it's because of viral bacterial infections. Allergies can cause the mucus to be secreting more, and other factors like nasal polyps, like growth in the nose, deviated septums. Dental problems can cause sinus headaches. Exposure to irritants like smoke can also contribute to sinus headaches. Nowadays we get more of sinus headaches also in Chennai, okay, and India. And management for this, removing the blockage, steam inhalation, which Amuda ma'am will be speaking, saline nasal sprays, staying hydrated, warm compress. Actually, you know what people will say, when you take a head bath that day, if you don't dry your hair properly, you will get a sinus headache. True, because you are not allowing the water to dry it properly. You are putting, especially for women, you put your band and it doesn't go and this gets blocked. Okay, but for sinusitis, there is a treatment that if you have to bath in quite warmer than usual water, but dry your hair well. Then you can also add eucalyptus oil, which Amuda ma'am will be speaking, which will actually relieve your sinus headache because the blocks will be cleared. Okay. Then pain relievers can help manage the pain, but decongestant to remove the sinus blockage is very important for sinus headache. So what are the three types of headache? Now you know what are the names. Can someone unmute and say what are the three types of headache we have seen now? Is it in the chat box? Can I get something in the chat box? What are the three types of headaches? Migraine, yes, G. Tension, yes, G. And the third one is sinus. Good. So band-like tension, one-sided migraine, but with the aura, nausea, everything. Then our butterfly sinus. Very good. Very good. Thank you all. Okay. So now we are going to the last fourth type of headache, which is cluster headache. And here comes our men. How I said migraine is more common in women. Unfortunately, this cluster headache, which is more severe than migraine, is very common in men. It occurs in male to female ratio 5:1. It's called alarm clock headache because it occurs in a typical timing for them again and again and again. We may think, why are they getting headache at the same time of the hour, especially evenings and night? And it will be specifically around one of the eyes, like this, okay? And eye pain will be there will be fluid from the eyes and also nose, rhinorrhea, then watery eyes, and it's a cluster headache. It will be very severe pain, okay? And they will be getting for 4 to 8 weeks. Then they will be free for 6 months to 1 year. They'll not have headache again. And this is again, it's related to genetic predisposition. If they have genetically cluster headache in the family, they will get cluster headache, okay? And it's called alarm clock headache. And it is mainly men who smoke or have alcohol and also use vasodilators in the presence of a genetic risk. Then the biological clock and the hypothalamus is affected, and seasonally they get, because the peptides, the neural peptides are secreted due to these triggers, and there will be this one nerve called trigeminal nerve. You don't have to go into it, but the trigeminal nerve is also affected in migraine, but in cluster headache, trigeminal nerve is classically affected. And there will be nose and ear drop, lacrimation and rhinorrhea. Vasodilation also will occur. So this is what causes cluster headache. Abrupt onset of headache originating in the eye. Pain is extremely severe. And I really pity the men who get it, because I've seen my father getting it. It's very, very painful. Okay. It lasts 20 to 60 minutes. The headache is associated with nasal stuffiness, rhinorrhea, redness of the eye, flushing and edema of the cheek, which we usually will see in Caucasian population, but not in our country. It will be like typical that eye pain, okay? Eye surrounding eye pain, okay? So this is how it will be, okay? This is how it will be. This is cluster headache. So management, this is very important. In migraine, even if you inhale oxygen, it doesn't help. But in cluster headaches, oxygen inhalation is the primary therapy which is being used elsewhere in the world. In India, not much of it at it. Immediately taking 100% oxygen will help in removing the certain neuropeptides which are secreted, so that the cluster headache immediately settles down, and there are medications for it, okay? Cluster headaches definitely needs treatment by allopathic practitioners or Ayurvedic or Siddha, or any type of medical practitioner should be involved to take medications for cluster headache. So, and importantly, why did I say we should not take medications again and again and again for headache? Because there's a medication overuse headache, which will happen when people for chronic headaches, daily they keep popping. Daily, if you take a painkiller, one day you will notice that there's no pain relief with the painkiller. And if you stop the painkiller, the headache vanishes. That's called medication overuse headache. It's there. And it transforms whatever was episodic into chronic headache. That is why we are having today's session, wherein with headache, understand the type of headache, understand the cause of headache, address the root cause with naturopathy and psychology, then go for painkiller if it's very terrible, or if you have other symptoms, definitely you should go to a doctor. So this is our medication overuse headache. So what are the 4 types of headache? You can see this. Sinus is butterfly, cluster is around the eye, tension is the pain like a squeezing band of head, band squeezing the head, and migraine with pain, nausea, and visual changes are the classical forms. So again, here is like this table where we can see pain. So can we are seeing it? Like first we saw tension headache, dull pressing, migraine is throbbing, pulsating. Sinus headache is deep, constant pressure. Cluster is stabbing. There will be like stabbing pain around the eye. So migraine can be one side or both. Tension headache will be full head, forehead, neck and all will be involved. Sinus is our butterfly. Cluster is one side or temple. And symptoms, again, only for migraine, it's more of vomiting aura, and for red eye and runny nose for this. The other things, nasal congestion for sinus and tension headache. So activity, aggravated by activity, it's only the migraine majorly, and cluster may trigger, but it's not linked to activity. So this is how it is, the 4 types of headache. So this is what I wanted to say. Now over to Neha ma'am and Amuda ma'am for their natural remedies and psychological remedies.
Thank you, Dr. Preeti. Namaste and good evening, everybody. Let me just share my screen before I move on to my presentation. Is my screen visible to everybody? Am I audible? Is my
Yes.
screen visible?
Yes, ma'am, you are audible and your screen is visible.
Thank you so much, ma'am. All right. So before moving on to my presentation, I would like to know what are natural remedies you've been following, like, for your migraine or headache in general, or headache caused due to dehydration, or whatever natural remedies. You can unmute or you can just type some in your chat box and you can let me know. I just want to know what natural remedies you've heard of. Anybody? Heat compress. Okay, so by heat compress, you mean a warm cloth placed on your head, if I'm not wrong. All right, meditation. All right, okay. Anything else? Drink water, go to fresh air, please. Nice. All right, okay. Anything else? Sleep. Yes, 100%. Yes, nice. All right, thank you. So moving on to my presentation, I'm Dr. Amudavashri, a naturopathy and a yoga practitioner. So I'll be handling today's session on naturopathy and yoga for headache management. Yeah, okay. So first, I'm sorry, yeah. So first we'll be focusing on what and all sort of diet we can have for our headaches. So basically the first and foremost thing is staying hydrated. So irrespective of the season, irrespective of if you're feeling thirsty or not, your daily recommended intake of water should be done. Why? Because water, just like how our earth is made up of 70% of water, 70% of our body is also made up of water. Okay, so water is very, very essential, not just for pain management, but also for detoxifying your body. So if there's a lot of toxins accumulated in your body, that will also cause inflammation, leading to lots of pain. Okay, so staying hydrated, you can just have just normal water of 3 to 3.5 liters, or you can just add a few pieces of lemon, mint, or cucumber for that extra cooling effect. Okay, so nowadays that infused water is very famous, right? So you can have lemon infused water throughout the day, or mint infused water throughout the day, or cucumber infused water throughout the day, or you can add all these three together and you can just have it as an infused water, like lemon, mint, or cucumber. Put all the three together and you can have it as your infused water. That has a lot of cooling properties and also helps in proper hydration. So the fiber from the cucumber and the vitamin C from the lemon and all will tend to keep you hydrated for a very long time, right? Next is eat light, frequent, balanced meals. Okay, why? Because during summer, given the heat and given the uncomfortableness which we are in because of the humidity and etc., for some of us, the metabolism tends to slow down. Okay, so instead of having like three main heavy meals throughout the day, we can actually cut it down to small, frequent meals, but balanced meals. Okay, so which has a proper amount of fiber, proper amount of probiotics, prebiotics for your gut health and also for your metabolism to improve. Right, so eating light, frequent, balanced meals, because once you bombard your body with a whole meal, automatically you will start feeling very sluggish, and once your digestion is not happening properly, your headache will also shoot up. Okay, so proper digestion along with proper hydration will help in managing your headache. Next is including more of cooling foods like watermelon, barley, oats, cucumber, your sabja seeds. All these come under the cooling foods category, which we all know. Tender coconut water, your buttermilk. So try including your diet majorly based on the cooling foods like watermelon, muskmelon, whatever you like. Okay, so try focusing. Even seasonal fruits can be had. Mango in moderation can be had. Right, so seasonal fruits can also be had for enhancing the cooling effect of your body. Magnesium rich foods, majorly your seeds and nuts, all sorts of seeds, pumpkin seeds, chia seeds, flax seeds, watermelon seeds, sunflower seeds, whatever seeds you have, and your nuts. It can be your almonds, your cashews, your pistas, walnuts, whatever. all these nuts and seeds, you can either make them into a dry powder and you can just mix it them with your normal milk and you can have it, or you can just dry roast them and have it as a snack. Okay, so whatever. Why? Because magnesium again has wonderful pain relieving properties. Okay, so that is why they say in women, when we get our period pain and all, they say have dark chocolate because it's rich in magnesium. Okay, so that magnesium is a wonderful pain relaxant. Okay, so having magnesium rich foods even during your episodes of headache can bring your headache down. Okay, so magnesium rich foods like your seeds and nuts, and yes, you can also have dark chocolate. Okay. And then you next thing in summer is majorly to balance your electrolytes. So through sweating, we have two forms of sweating. One sweating is invisible and the other sweating is visible. Okay, there are some scientific terms for it. So I'm just giving you a very rough outline as to two types of sweating we have. Okay, so through sweating, along with the toxins from your body, even some of your electrolytes tend to move away from your body. Okay, so to maintain that electrolyte imbalance, that electrolyte balance is very much essential for your cell function, for your kidney function as well. Okay, so that for the glomerular filtration rate and all, for the kidney function, these electrolyte balance is very much important. Okay, so in summer, especially with all this humidity and with the increasing temperature of the sun, etc., we tend to sweat a lot more even if we go for a normal 5 to 7 minutes walk. Okay, so it is very, very essential to balance your electrolytes, and the major element to balance electrolytes naturally is your coconut water. So that is why we have so many stalls of tender coconut along the road, especially during summers, because it's your natural electrolytes. It's not your ORSL or your ORS powders. Apart from that, your natural alternative will be your coconut water. So try having coconut water at least once a day to balance your electrolytes, irrespective of the physical activity which you do, because your sweating happens visibly and also invisibly. So to balance electrolytes, have tender coconut water at least once a day. And then warm milk with a pinch of nutmeg before sleep. This is majorly for your stress-related headache. So after a long day of work or after a long day of family emotional stress, or whatever kind of stress you're going through, at the end of the day, before your bedtime, let's say 30 to 45 minutes before your bedtime, you have a cup of warm milk with a pinch of nutmeg. And just before sleep, just add a little bit of nutmeg, and a pinch of turmeric also can be added to this warm milk. Okay, so that will also help in relaxing your mind and your nervous system, thereby relieving your stress. Okay? And fasting once a week for detox. So this is one very nice technique in naturopathy where we advise patients, irrespective of their condition, like if they have insomnia or if they have diabetes or if they have hypertension or headaches. So this is majorly caused due to accumulation of toxins in the body. That is one of the major reasons as to why a disease occurs according to naturopathy. So when you fast once a week, what happens is the toxins, because your digestive system is at rest. Okay, so once your digestive system goes to a rest, automatically your body will start focusing on the detoxification process, right? So continuously, if your digestive system is working, your body will spend its entire energy in digesting the food which you eat. So when you give a rest for the digestive system, automatically your body will kick-start its detoxification process for that entire day. Okay, so by fasting, it does not mean like, not even having anything, just staying without water and without food for that entire day. It's not like that. There are different kinds of fasting which a naturopathy practitioner will be able to guide you according to your body type. Okay, so like say you have water fasting, you have fruit fasting, and then you have, yeah, fruit fasting is also there, water fasting is also there, and then you have something called a sattvic fasting where you do not have salt and you just have like warm khichdi or like very gentle foods which you can have, right? So you have different forms of fasting which a naturopathy practitioner will be able to guide you. And yes, intermittent fasting will also help. Intermittent fasting, like say 16:8 ratio, where you eat for 8 hours, you fast for 16 hours, or is the vice versa, you eat for 16 hours and then you fast for 8 hours. Again, the ratio will differ in intermittent fasting for each body type. So before starting any form of fasting, you will have to consult your naturopathy practitioner and then you can start. But these techniques in diet will actually help in managing your headache. And coming to what to avoid, avoidance, irrespective of the type of headache, will be your excess salt, sugar, and caffeine. As Dr. Preeti had already discussed, when you have migraine, having caffeine in the form of coffee, in the form of aerated drinks, etc., will actually trigger your headache, right? So you should avoid excess salt, excess sugar, and caffeine, processed and oily foods, because again, the excess salt, excess sugar, processed and oily foods, they tend to cause a kind of stress to your body. I don't want to elaborate more on that because it's a form of stress because it's not needed by your body in such huge amounts. So whatever is required by your body is like, say for example, if you're taking sugar, your body requires only around like 5 to 7 grams of sugar per day. That is more than enough. Okay, but a 5 to 7 grams of sugar is like almost like half a spoon or even quarter a spoon. Okay, that's it. But that's 5 to 7 grams. But what we do for a single cup of coffee, we add like 2 to 3 spoons. Maybe there are some people who I know who tend to have just for a half a cup of tea, they tend to have 2 to 3 spoons of sugar. Okay, so that comes somewhere around 10 to 12 grams of sugar. Again, too much of sugar leads to something called as insulin resistance. So insulin resistance will lead to higher secretion of cortisol in your body, and that cortisol is nothing but your stress hormone. Okay, so the more amount of cortisol in your body starts secreting, the more amount of pain you will start to have, and the frequency of your headaches will also start to increase. So keeping your cortisol at bay, keeping your caffeine at bay, and keeping your salt, your processed and oily foods at bay will help you in managing your episodes of headache. Moving on to the right. So an idea, just to give you an idea, because we were speaking about the probiotic and the prebiotic foods, because your gut health is also very important. Okay. So probiotic foods are food which have the bacteria in them. That is the good bacteria which are present in your gut. Those are the probiotic foods. And the prebiotic foods are foods which are food for the bacteria which are present inside. Okay. So your diet should always have a combination of carbohydrates. Like you can see the balanced diet chart over here, where in a round plate you have 40% of your fruits and vegetables, 25% is for your carbohydrates, 25% is for your protein, 10% is for your fat. Along with this, a little portion of your probiotic and your prebiotic should be there. Okay, so some examples of probiotics which have the bacteria in them will be your fermented batters like your idli, your dosa. All these tend to have the good bacteria in them when had. And then the curd, your paneer, your green peas, soya milk, all these tend to have the probiotic effect in them. The prebiotic foods will be your onions, the green banana, the garlic. So all these are prebiotic foods, which we majorly use in our diet, but we are not aware of the medicinal properties which those have. So the prebiotic and the probiotic in combination, along with your balanced diet, should be your ideal diet, not only when you have headaches, but throughout your everyday life as well. Right. So coming to water intake recommendations, for children from 1 to 3 years of age, 0.9 to 1 liter. Children for 4 to 8 years old, 1.3 liters. Girls 9 to 13 years old, 1.5 liters. Boys 9 to 13 years old, 1.7 liters. Women 14 and over, 1.6 liters. Men 14 and over, 2 liters. Right. So this is taken somewhat a few years back, but currently I would say for men and women, the rough average will be somewhere around 3 to 3.5 liters, especially during summers. And maybe in winters, you can just try to keep an average of 3 liters, right? And coming to how much sleep is enough. Why do you think sleep is enough? Okay, I saw a lot of people telling sleep helps you in headache. How and why do you think sleep is very important for reducing your headache? You can just type 1 or 2 sentences in the chat box. Or you can even unmute yourself and sleep. You can just tell it, unmute yourselves and tell why is sleep, how does sleep help in relieving your headache, or why is it important? Anybody? Nobody? Why is sleep important? Rest. Okay. Melatonin hormone is activated. Okay. Okay. Right. Okay. So yes, so both of these are right. So when you go into a state of sleep, okay, so what happens is your heart rate comes down, your blood pressure comes down, your body goes into a state of rest. Okay, so that rest is actually important for your body to rejuvenate itself and refresh itself. Okay, so that is why we say have an early dinner and go to bed at least 2 to 3 hours post dinner, so that your body does not get involved in the digestive process when you're trying to sleep. Okay, so when you're sleeping, your body does the process like detoxification, rejuvenation, so that when you wake up in the morning, you feel refreshed. Okay. So when you sleep early, when you have a light dinner and you sleep properly, at least for 7 to 8 hours, a good tight sleep, what happens is your body restores itself. So that restoration will help in removing any sort of headache causes. Okay, whatever reason your headache is occurring, that restoration will help in identifying the cause and removing it. Okay, so the body will heal naturally only if you sleep properly. All right. And as ma'am said, the melatonin hormone, that is nothing but, like, say, for example, that hormone is basically for your sleep. Okay. But what happens? We lie on the bed and we just keep looking at the phone, and the blue light from the phone, it tends to just deceive our brain, telling that we are still on the daytime. Okay. So when the light keeps falling onto your retinal nerve or something like that, what happens is your brain tends to think, okay, it's still the morning, so it starts activating your nervous system. It starts having a hormonal imbalance. Your circadian rhythm tends to get disrupted, as a result of which you don't get enough sleep. And once you don't get enough sleep, your body does not restore itself. And once your body does not restore itself, what happens? The pain which you had the day before will keep continuing. In fact, you'll start to increase the next day if you don't have a proper sleep. So try to sleep. So the average sleep for infants for 4 to 12 months will be 12 to 16 hours per day, including the naps. For children, 1 to 2 years, 11 to 14 hours a day. For children 3 to 5 years, 10 to 13 hours. Children 6 to 12 years, 9 to 12 hours. Teens 13 to 18, 8 to 10 hours. And adults 18 plus, 7 to 8 hours per day. Right. So this is an example of how much on an average sleep is needed by each adult. Right. And moving on to the sun exposure. So sun exposure is very essential. You can ask me, ma'am, when I go out in the sun, I start to sweat. Right. So there are quite good timings for sun exposure. Like, say, in the morning, especially as soon as the sun rises, the initial 1.5 hours. Like, say, for example, the sun is rising at 6 o'clock. We'll keep it as 6. So 6 to 7:30 will be your ideal time. And evening, just before the sun sets. So that, like, say, we'll just keep the same 6 o'clock as the sun setting time. So maybe it will be 4:30 to 6. So that will be your ideal time for sun exposure. Morning 1.5, evening 1.5, right? So it's not like you will have to expose yourself entirely for this 1.5 hours. In this particular time period, if you expose yourself for a minimum of 20 minutes, is more than enough for that vitamin D to get secreted in your body or get absorbed by your body, right? So what happens is, when this vitamin D or when these UVA and UVB rays, particularly in that 1.5 hour time in the morning or in the evening, comes in contact with your skin releases something called as nitrous oxide, right? So this nitrous oxide is a vasodilator. By vasodilator, I mean it's going to improve the blood flow. So now, anywhere where there is pain, what happens is there is a restricted blood flow. So as there's a restricted blood flow, there tends to be pain. Okay, so once the blood flow starts to expand, or once there's a improved blood flow to that particular area, the pain will automatically tend to reduce. So same concept is here for your headache as well. So exposing yourself to the sun, especially in the morning 1.5 or in the evening 1.5 hours, will actually help in vasodilation. That is just improved blood flow to entire body. Right? So that will also help in relieving your pain. So that is the science behind exposing yourself to fresh air. Okay, so fresh air is nothing but you get fresh air especially during the daytimes, right? So that is more fresh. So during the daytime, when you go out in the sun and you inhale the fresh air, you take in good amount of oxygen, and also coming in contact with the sun will also help in improving your blood flow, thereby relieving your pain. Right. So moving on to hydrotherapy. Right, so hydrotherapy is nothing but just using different temperatures of water for treating your particular condition. Right, so especially coming to headache, we all generally suggest cold food bath. Right, so by cold food bath, we mean, like, just immersing your legs in not very ice cold, but just neutral water. Neutral to, even you can use warm water here, but I forgot to mention that. I'm sorry. You can also use warm food bath or a cold food bath. Right. So that again tends to constrict the vessels of your food, thereby releasing the vessels on your brain, which tends to improve the blood flow, right? And then cold compress or warm compress to forehead, or even mud packs to forehead. Okay, so I'll tell you the science behind the mud packs to forehead. So the mud packs to forehead, they tend to have a very cooling effect. And the mud which we use in mud packs is not the normal mud which we get in our surroundings. It is called as the I would say not the clay mud, but a different form of the clay mud. Okay? So that clay mud, when it's mixed with water and it's put on a cotton cloth and kept on your head, it tends to have wonderful cooling properties. And because of the cooling property, your detoxification process starts. So if there's any toxins accumulated in and around your head, okay, if there's any inflammation in and around your head, regular application of mud pack will actually remove the toxins and help in strengthening the nerves and the muscles of your face and your head region, right? And neutral spinal bath. Why do you think spinal bath is very important? How is spine related to your head or your headache? Anybody? Why should we target the spine?
The brain continues into the spinal cord, so if we can manage the spinal cord, maybe the headache would be reduced.
Yes, ma'am, 100%. So yes, as ma'am said, most of our nerves, they arise from the spine. Okay, your spine is like the major part, which is like almost connected to all the single parts of your body, right? So it has connections to each and every nook and corner of your body, including your brain, as ma'am said, right? So strengthening your spine will actually strengthen not only your brain but your entire body as well. And that is where the neutral spinal bath comes. So neutral spinal bath is just like you just lie on a very normal bathtub where your spine is just touching the water. Okay. So when you come in contact with that neutral water, not warm, not cold, just neutral water, it helps to tone the nerves. By toning the nerves, I mean strengthening the nerves. And once your spinal nerves is strengthened, automatically that strength will actually spread to your entire body, including your head, managing your headache. And the same science is also behind the neutral immersion baths, where you immerse your entire body except for your head. So your head will stay out just like how you lie on a bathtub. Okay. So except for your head, other entire body parts will be into the water. Again, that is also for toning effect. So anything which is cold and neutral is for your toning, and anything which is warm is for your vasodilation, right? So just keep this in mind. So whenever there is any swelling or something, we'll advise for a contrast hydrotherapy, like where we say apply cold and then followed by heat. And whenever we need to strengthen a particular area, we'll apply cold and neutral. And whenever we look only for pain management, we'll apply hot, right? Fine. So this is regarding hydrotherapy. Now coming to herbal decoctions for pain management. At home, what and all herbs we can do and how we can make the decoction, right? So first, mint, coriander and fennel. Okay, pudina, this dhania seeds, and the fennel is sombu, which we call in Tamil. Right, so you can just take a few mint leaves, 4 to 5 mint leaves, 1 small spoon of coriander seeds, and 1 small spoon of fennel seeds. Right, so you take 200 ml of water, put these all the three into the water, bring it to boil, reduce the water to half, strain it, and drink it. Okay, so this majorly has a wonderful cooling effect. So the headaches caused due to heat and dehydration can be better managed with these kind of decoctions. Right. Next is Brahmi. Brahmi is a type of herb which is available in the market. I think you get it in powders as well. Right. Brahmi and Shankapushpi. Shankapushpi is a Sankapushpam flower which we get. Yeah. So you can just use the petals, or you can even use the dried flowers which you get in the market, and you boil them, strain them, and then have it as a decoction. This is majorly for stress-related headaches, because the Brahmi herb has a wonderful stress relieving capacity. Right. So for stress-related headaches, you can actually use this Brahmi and Shankapushpi decoction. Next is dry licorice, and coriander decoction. The same way, all the decoctions can be prepared in the same way, right? So this is majorly for the headaches due to common cold, fever, or any form of infection, for your sinusitis. For all these forms of infection, you can use this decoction. And next, ginger and tulsi decoction, again for your migraine, right? Because ginger has a lot of anti-inflammatory properties, so any form of inflammation in your head will be reduced. So ginger and tulsi decoction, again for your migraine-related headaches. So these are just a rough idea. We do have more decoctions as per every individual's body type, and every individual's reason or trigger for headache. So this is just a general outline, but we do have different decoctions. So you will have to consult, and then you can start having the decoctions as well. So coming to yoga and pranayama for pain management, these are some yoga poses which are majorly focused on improving the blood flow to your brain. Okay, like say Adho Mukha Svanasana is like downward facing dog. So your body becomes like this inverted triangle, which is also a pose in Surya Namaskar. So when you put your head down below your chest, automatically the blood flow improves. So when you stand like a triangle, you place and then you form like a triangle, that becomes a good blood flow improving pose for the brain. Right, and then Supta Baddha Konasana, which is butterfly pose and lying down, that also helps in improving the blood flow to the brain. Viparita Karani, that is nothing but putting your legs 90 degrees on the wall and just lying down. That is wonderful for improving a blood flow from your lower limbs, and also for removing any blood stagnation in your lower limbs or something like that. And it's also a wonderful stress relieving technique. Balasana is child pose. Again, it improves the blood flow to the brain. And Sheetali and Sheetkari pranayams are actually called as cooling pranayama, and they are a must to do, especially in summers, right? So Sheetali and Sheetkari, I'll just teach you how to do Sheetkari. In Sheetkari, it's just like clenching teeth breath. So just like how you're going to brush your teeth, you're supposed to clench both your teeth together, right? And then you're going to inhale through your clenched teeth, Close your mouth and exhale normally through your nose. So that is how you do Sheathkari Pranayam. I'll just do 2 rounds. You can just see. So I'm going to clench my teeth. I'm going to inhale. And I'm going to close my mouth. And I'm going to exhale. So when you keep doing it repeatedly, okay, when you keep doing this repeatedly, you will find your entire oral region becoming very cold, right? So all of you want to try maybe for 1 round. Yeah. Can all of you try for 1 round?
Yes, ma'am.
Yes, ma'am, please. Just all of you clench your teeth. Yes. And now you're going to inhale through the clenched teeth. And then you close your mouth and exhale normally through your nose. Yes, can I have 1 more round with all of your videos on if that's okay? I just want to know if all of you are doing it fine. I can only see Neha ma'am's video. Yes, Nitya ma'am, thank you. Others as well. Just 1 round with the video on. Yeah. Yes, all right. Others have not yet switched on. Okay. Yeah, we'll just do 1 more round. Clench your teeth and inhale, making a hissing sound. You close your mouth and then you exhale normally through your nose. Yes, all of you can close your eyes and just try practicing it. Clench your teeth, inhale through your clenched teeth. Close your mouth, exhale normally through your nose. Yes, can you all feel that cool, cool feeling inside your mouth? Yeah, can you actually feel that? Yeah, all right, yes, all right. So this is one pranayam which tends to cool your body heat completely. So if you're suffering from a very heated body due to summer or something like that, this does not become a compensation for having less water. Okay, you should have less, a good amount of water, and you should keep practicing this pranayam as well. Okay, just because you're dehydrated, just practicing this pranayam will not magically restore your hydration levels. No, water is separate and this cooling pranayams is separate. Your diet is separate. So all these three, everything together gives you a holistic method to manage your headaches, right? And Brahmari pranayam again is majorly for your stress relieving, or it's majorly for your relaxation, and it also helps improve the blood flow to the brain. And meditation in all forms, like it can be in the form of yoga nidra. I think we'll be sharing a yoga nidra audio to you as well, I think, if I'm not wrong, right? So yoga nidra, or any form. You also get these DRT techniques, that is deep relaxation technique audios in YouTube, which you can also play it at the end of the day and you can keep listening to it and you can relax yourself, right? Or just normal, close your eyes and just visualize lots of positive things. I think that will be handled more better by Neha ma'am. So visualization techniques will also help in managing your pain, right? So last but not the least is aromatherapy. So aromatherapy is nothing but therapy using smell. So you get different forms of essential oils, right? That is nothing but herb oils. The oils extracted from natural herbs. So those oils tend to have a lot of healing properties or therapeutic properties. Like say lavender oil, peppermint oil, eucalyptus oil, rosemary oil, and chamomile oil. All these 5 oils in general put together, they have a wonderful pain managing effect, and they also help in relieving your stress, and they also help in improving your sleep, right? So they have like different components present. Like in lavender you have linalool. I'm sorry. Yeah, in lavender you have linalool. In peppermint you have methanol. In eucalyptus you have euclin is a component in eucalyptus. Yeah, so you have different components in lavender oil, peppermint oil, eucalyptus, rosemary, and chamomile, which tend to relax your pain, and also they help in improving your sleep, improving your mood. Yeah, so all these aromatherapy techniques can also be done for pain management. So how do you do this aromatherapy? Like in what form can we actually use these aroma oils? First is diffusion, just like your room freshener, as you can see in the first image. You have a diffuser, you add 2 to 3 drops of this oil and you just use it as a room freshener. Second is massaging the aroma oil with dilution. By dilution, I mean you can use a few drops of almond oil and you'll just have to mix whichever aroma oil you need to. Like say if you want to use lavender oil, just use 2 to 3 drops of lavender oil mixed with 1 to 2 drops of almond oil, and you can just apply it on whichever area you need it. Like, if there's a head pain, you just apply it on the head. If there's a knee pain, you apply it on the knee, right? So you can just directly apply it on the skin, but mixing it up with the carrier oil is very important. And then in baths, like, in just a normal water in which you take bath, not the hot water, either neutral or just cold water, not very cold, not very hot as well. Just neutral water, just add 1 to 2 drops or 3 to 4 drops of the aroma oil, whichever you need to, and you just take bath in that water. And as we all know, inhalation. So inhalation in the form of steam inhalation or just normal inhalation, just put 2 to 3 drops of the aroma oil onto a tissue paper or onto a handkerchief which you carry, and just keep smelling it throughout the day. So these are 4 major aromatherapy techniques which can be practiced by ourselves to ourselves. Right. So you do have combination aromatherapy techniques based on your body's individual need, which a naturopathy practitioner will be able to guide you better. Right. So with this, I conclude my naturopathy and yoga for pain management. Regarding the psychological aspect, I request Neha ma'am to take over. Thank you, everybody.
Thank you, Amuda ma'am. Thank you very much. Namaste and a very happy evening to all of you. How are you all? We are taking up your time on Sunday, we know that. So a Sunday evening is very important. So we'll wrap it up quickly with the last part of today's, or the last segment of today's webinar. Before that, I'd like to thank Preeti ma'am and Amuda ma'am for laying the foundation so that my work becomes easier when I'm talking about the psychological aspects. So you have been sitting and listening to us for quite a long time now. So why don't we relax you a bit, right? I mean, you have been holding your mobiles like this. You have been looking into the computer like this. So why don't we just relax you? Okay. So I'd like you to do a very simple, quick exercise for 10 counts. Okay. What we are going to do is, with our hand, we are going to press our temple, and with our head, we are going to press the hand. So from the hand, the pressure goes to the temple, and the face, you have to make it straight. Okay, so both the pressures have to come together. Okay, so we'll do it for 10 counts. So can you all do it with me? If you can switch on your video, fine. That would enable me to get a better idea. Just hold and push for 10 counts. Not both the sides, Nitya ma'am, only one side. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And I can see a very small girl also doing it. Thank you very much. And we'll do it on the other side as well. Okay, for the other side, same. For the other side, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So what we basically did was, this region, the back of our neck and the shoulder, is the place where we get maximum stress. And this is the stress that is the first step which causes pain, that is back head pain and your central head pain. So whenever you have this, if you keep relaxing your neck muscles and your upper shoulder muscles, the chances of having this pain reduces. So you can try it as and when you can. Okay, with this, I'll present my screen and we'll begin with today's last part of the webinar, that is mind solutions for headache relief. So both Preeti ma'am and Amuda ma'am mentioned about stress being a major cause for headaches. So we will see 4 main reasons as to how our emotions contribute to our headache. So the first one is unresolved emotions. So all of us have this inbuilt anger, anxiety, or guilt. Anger on someone, someone has done us some wrong, but we are not able to shout it out at them. Or we want to shout it out, but we have shouted it out, but it's still there in our mind. Or some sort of continuous anxiety, work related, housework related, or if you are having someone who is very aged or is under any medical treatment for a long time, prolonged treatment, then you are continuously anxious, or you have someone in your house or in your workspace or in your area who gives you lots of anxiety and stress, then you are in continuous anxiety, right? Or you have a guilt about something. That thing has happened, but even today you regret for it. So such unresolved emotions will trigger the so-called fight or flight response. That means our body will be like, okay, now there is a danger, I have to fight. Oh no, there is a danger, I have to run. So it will have a fight or flight response. So all our muscles will be ready, okay, either I have to fight or I have to run. So there is a persistent tension in the muscle. Like Preeti ma'am said, tension is more related to the physic than to the headache, or rather to the stress or the emotional thing. Your body muscles are continuously constricted, okay, because it's like, okay, now I have to fight or I have to run, which leads to tension type headaches. Next is when, I'm sorry, yeah, when you have some unresolved uh, emotions, okay, or some just a minute, yeah, some suppressed emotions, that you wanted to say something but you have not been able to say, you wanted to shout but you have not been able to shout, you wanted to speak out for yourself but you have not been able to speak out for yourself, which leads to distress. In such case, there is a dysregulation in the autonomic nervous system. Nah, ma'am, there's such a big word, autonomic nervous system. Nothing to worry. It is the system, the nervous system that controls all the involuntary actions: beating of the heart, breathing, movement of the lungs, movement of the diaphragm, gastric secretion in our stomach. All these things which are not controlled by our command. They are controlled by the autonomic nervous system. Okay. So what happens is this part gets dysregulated. That is, the heart starts beating fast, or there is lots of gastric juice secretion in the stomach, which leads to a long prolonged state of sympathetic arousal. Whatever this I'm saying, no, fast heartbeat, fast breathing, continuous gastric secretion in your stomach, the diaphragm coming up again and again, which leads to hiccups, these are called as sympathetic arousal. It regulates our normal pain modulation. That means earlier what you felt as pain, it is very less pain, like that, but whatever you felt, now you start feeling that that pain is more. You become more reactive to pain signals. I'll give you one very simple example. You don't sleep properly for 2 to 3 days, okay, and your autonomic nervous system will be continuously active, and your sympathetic arousal system will be active, because of which even a small cut through your knife, which otherwise you would be like, I got a knife cut, now you'll be like, it's paining, it's paining, it's paining. Similarly, it happens with the headache as well. The other reason can be, I hope, I know many of you, not hope, I'm so sorry, I know many of us have this rumination. Why did this happen? How did this happen? I should have done this. No, this is not right. Oh shit. Right? All this rumination. Perfectionism. Oh, my work should happen perfectly. This is not perfect. It should be like this only. Or catastrophizing. Oh my God, now this has happened. Next, this will happen. After that, this will happen. And they will throw me out of the job. They will throw me out of the house. Right? Catastrophizing. If you are having these thoughts, then our emotional stress is always in a height. It is called as heightened emotional stress. We are always in a state of emotional stress. Our body is like, everything has to be done perfectly, so be prepared. It keeps on ruminating. So these leads to our HPA, that is hypothalamic pituitary adrenal axis. You don't need to know the name. I have just put the name. That is a part of our brain which is continuously in stress. That is, the muscles of that part become constricted, because of which cortisol is secreted more in the body. Now, this cortisol, many a times we have told in previous webinars as well, Amada ma'am and Preeti ma'am have always emphasized on us, this is called as the stress hormone. It is the one that makes our sympathetic arousal fast. It is the one that keeps our muscles and tension, in a continuous tension. It increases, and like Preeti ma'am said, migraine and chronic headaches, they start to set in. Usually, the reason for migraine and chronic headaches have been traced back to rumination. You continuously overthink, or you are in a continuous mode of perfectionism, or you are in a catastrophizing mode. Yes, for migraine, there is a genetic reason which is always there, but the psychological reason worsens it. And the last part is repressed grief. You have had a trauma or a grief, but you have never addressed it. What happens is when you have a long standing trauma, this pain acts like a psychic pressure valve. That is, all of you have cooker at your home. You keep food in the cooker, right? And what happens when the steam builds in? After some time, the pressure valve will release the pressure in form of whistles, right? Similarly, this pain, whenever we have a long-standing repressed trauma, the pain is coming out like whistles from our body. Like the analogy is of the whistle and the pain, which is like the pressure of the body telling that, showing the pain and telling that, okay, you need to address this issue. Okay, this is a mind's way of managing overwhelming feelings and they convert it into pain. Okay, now that we have seen these 4 types, I want you all to note down. Okay, if you all for this session can have a book and a pen, if you have a few color pencils, crayons, sketch pens, color pens, anything, that would be great. Okay, so out of these 4, which one do you think are the reasons for headache in you? We all have a slight idea. We know what is it. Usually we know it is anger, anxiety, is it guilt, is it long time of emotional suppression, I want to speak, no one allows me to speak, is it catastrophizing, what is it? I want you all to note it down in your book. Why? Because this is the first part of the reason. The second part is coming up next. That is biofeedback. Okay. Biofeedback, how it works is you have a stress or an emotion. Okay. And your biofeedback detects it. So, in many of the advanced countries, you have something called as a chip or a trigger, sorry, uh, electrode, which is placed in different parts of the body. Okay, and whenever you have a stress or an emotional trigger, this these electric rods, which are usually placed in your scalp or in your jawline or in your shoulder, they will detect it, and then they will be like, there will be a psychiatrist or a therapist who will be sitting for you in the session, and they'll be like, okay, this is that you are having some sort of emotional trigger, what is the thought that you are having, and then they will address the issue and a new neural pathway will be formed, that is neuroplasticity. That is again and again doing such thing, our brain will again and again, we will learn to control that aspect of the emotion or brain, and thus our brain sets into a new neuroplastic pathway. How that happens? Trust me, this can be done without electrodes and chips. And that is what we are going to learn today. Okay? For this, you need to know first thing. Whenever you are tensed, which part of your body gets tensed? Have you ever noticed it? If not, I want you to notice now. So usually whenever you are tensed, is your eyebrows going like this with lots of wrinkles here? If that is the case, then it is usually frontal tension headache that will start with. It might not work. I mean, this is what most of the people have told. It might not be the same for you, but that is how the thing starts. You usually go in for frowning of your brows, and all your concentration and worry comes here. Then the jaw and the temporal mandibular joint. This is the jaw and the temporal mandibular joint, this area. Okay, including your ears. Okay, you clench your teeth or you grind your teeth. That is a way to suppress your anger or anxiety. Is it your neck? That is when you start getting tensed, you start drooping, becoming like this. You know, if you are drooping, your posture becomes poor. That can be a reason. Shoulders, does your shoulders become like this when you are tensed? Okay, it is also called as the armoring response. Here in the scalp or in the crown region, you feel something is pulling both the sides. This is usually because of hyper overthinking or hyper arousal. Eyes, you get into a tight gaze, you know, you're just staring like this without even blinking your eyes. That is a type of emotional stress. Or fast breathing, very short breathing. You are not giving continuous oxygen. You're not, there is a lack of oxygen. You're just breathing very fast. It is very short, not deep, very short breathing. And overall sympathetic arousal. Now, out of this, I want you to note down which part of your body shows that you are having a stress. Like for me, it is usually the jaw and the temporomandibular region along with my shoulders. I would usually, whenever I would get tensed, I would see that my shoulders have become very constricted. So, have you ever noticed this? If you have not, notice it. And if you have, make a note of which region usually you constrict when you are tensed or when you have stress. Okay. Now, coming to the third aspect, we have seen the emotional reasons, we have seen the physical signs. Now we'll come to the thoughts. Okay, whenever there is a headache, what do you tell yourself? The thought that comes to your mind. Suppose you're working and you're like, oh no, time is less and I have to do this work perfectly, do this work perfectly. Is it like that? Or it is like, no, 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 I should do it this way. This is how things should happen. Or are you like, why did they tell me like that? They should not have told me like that. Who told them to tell like that? Do I tell them things like this? Is it anger? What are the thoughts? Automatically these thoughts come to you whenever you are stressed. Like today morning, I'll give you this example. I think most of the women can relate to me when I say this. Today morning I was stressed. Lots of housework was there. Okay, and my poor husband, he woke up late. I wanted to shout at him, but I didn't want the day to go bad. So I did not shout at him. And I kept on ruminating on the thoughts. What is this? I got married means it is only my work. It is not his work. He should not do. Those thoughts kept on coming to me for close to half an hour, 45 minutes. And I'm like, okay, stop. Okay, stop. And then I examined the evidence. Is it really true that he never helps? Or is it that he woke up today late? So I decided, okay, I'll identify first the thought disorder in me. My thought is all or nothing. I have written three: catastrophizing, all or nothing, or should statements. Mine was all or nothing. That is, he never helps. But is it true? No. There were many instances where he has helped me. He has been supportive to me. Right? Few people will have catastrophizing. Oh no, so much work has to be done. Nothing will get done today. My whole thing will go bad and the whole day will go waste, like that. A few of you will be like, we will be having should statements. This should happen like this and it's not happening like this. That means it is fault and the whole, oh, it is wrong and the whole world is going to end. So what is it? So once the cognitive distortion is identified, create a balanced thought. So the balanced thought that I created was, okay, there have been many days where he has helped. Today I need help and he's not able to help me. So what next? So I'll do the work that I can do, or I can go and ask help. So when I asked him, he was like, no, I'm feeling very sick. And unfortunately, he was having a very bad stomach disorder. So that at least when I calm down, I could ask him rather than when he wakes up, I shouting at him and during the whole day, right? So identifying that automatic thought, examining the evidence, and what cognitive distortion I'm having, which is leading me to have this automatic thought, and then creating a balanced thought and solving the problem will help us. Okay, I hope this example helped you. So this is the third thing, that is the thoughts. Now coming to steps to manage headache. Now all the three we will bring together. Okay. So whenever we have a headache, we identify the body signal. That is, am I having a clenched teeth? Am I having a broad furrow? Or that is, my furrows are they are broad, eyebrows they are furrowed. I'm so sorry, eyebrows they are furrowed, or the shoulders they are uptight. What is it? Okay. And then I'll link it to the trigger. Okay. Now something happened that is making my body give such signals, and that is why the headache started. Okay, and then I'll manage that emotion. When you keep on practicing this again and again and again, headache body signals and what trigger happened in the morning, yesterday night, today morning, 2 days back. When you identify to the trigger, something my husband told me, I had a fight, something my boss told me, I had a fight, the auto wala did not give me 10 rupees change, whatever it is. Okay, that led me to get tensed. My body showed me signals and the headache was there. And now I have to manage the emotion. When you start practicing this regularly, what happens is automatically when you start having the trigger, that is you fighting with your husband, oh, okay, if I continue with this fight, my headache is going to come again. I'll take a step back. Oh, okay, if I fight with the auto Anna for 20 rupees, it will give me a whole day's tension. Or I trying to do a work in a perfect manner. Okay, if I do this perfectly or I run behind perfection, then I'm going to get a headache. So I'll step back. I'll do how much ever is possible from my end. Okay, so every time automatically your body will start identifying the trigger before the headache starts. And it will relax the body parts. And automatically it will start managing the headache even before the headache starts. Like for me, usually my gastric juice, I'll get acidity. So gastric juices will secrete more when I'm tense. So if I have a fight, I know, okay, I'm going to get that. So I usually drink buttermilk. I relax myself. I do deep breathing so that I can avoid the headache. Okay. Now, all of you, I request you to do one small thing. That is, I want you all to write down, draw this small human gingerbread figure. Okay, if you have your book, your notebook, your diary, I request you all to draw this small, it may not be perfect, however it is possible, draw this ginger man humanoid diagram. Okay, and mark the places where you feel the tension. If it is the shoulders, mark the shoulder. If it is the head, mark the head. If it is the eyebrows, mark the eyebrows. If it is the jaw, mark the jaw. If it is the neck, mark the neck. If it is the back, the lower back, mark those part. Mark the part of your body where you feel tensed. I'll give you a minute for this. And if you can also share it in the by switching on your video, this diagram, it would be a great help. Draw this diagram and mark the part where you feel your tension, the part of the body where you feel the tension. It can be your head, it can be your shoulder. And if anyone has drawn, I request them to switch on their video and show the picture of it so that others can also get an idea. It need not be a perfect picture. You can also draw a stick model of human being, that is fine. Yes, yes. Has anyone drawn it? Can you show it opposite to your video? Yes, I think Komal ma'am has drawn it. Yes, Komal ma'am. Okay. Can you hold up your diary a bit higher, ma'am? Now, okay. Yes, we can see it in the end. A bit higher. Your diary alone, if you can keep it a bit higher. Yes, we can see it. Help, ma'am. Thank you. Thank you very much. Good. Thank you, Komal ma'am. Because of Komal ma'am, we all got an idea as to how it has to be done. Good. So I hope others have also done it. Now I want you to look at this picture and imagine yourself. I want you all to look at the picture that you have drawn and imagine yourself. Okay? Look at the picture deeply and imagine yourself. And now we are going to do a short 3 minutes relaxation technique. Okay. So now with the picture in your mind, imagining yourself in that and imagining the parts of your body that get stressed whenever you are tensed. I want you all to close your eyes and sit comfortably. Gently close your eyes and sit comfortably. Rest your hands loosely and allow your body to soften. Preeti ma'am, I would request you to share the singing
Sure, ma'am.
bowls music, ma'am. All of you, close your eyes. Be seated comfortably. Your eyes let your eyes be closed very relaxedly. Let your hands rest very loosely. Allow your body to go relaxed and soften. Take a slow, deep breath through your nose. Slow, deep breathe through your nose and slowly let it out. Once again, take in a deep breath through your nose and gently exhale through your mouth. Please take another deep breath through your nose. Feel the cool air going through your nose into your lungs. And gently exhale through your mouth. Now bring your attention to your shoulders or jaws or eyebrows, wherever you feel the tension. Bring your attention to that part. Simply notice them without changing anything. Just notice, just observe. Are they tight? Are they lifted? Are they drooping or relaxed? Now take a deep breath in and exhale through your mouth, imagining your shoulders beginning to soften. Imagine they are melting downwards, away from your ears. Let the gravity do the work. Let your shoulders loose. Let them not be heavy. Let them soften. Breathe in and breathe out and say silently, I release the tension. I welcome the ease. Now shift your focus to the other part of the body where you can feel the tightness, the stress, the tension. And again breathe in deeply and exhale through your mouth and release the tension from that part. Welcome the ease. Let that body relax completely, that body part relax completely. Keep continuing to take deep breath in and deep breath each to your body part. I'm releasing you of the tension. I welcome the ease. Keep breathing in and out and tell yourself, I am safe. My body is allowed to rest. Let this ease spread across your arms, your chest, your legs, your fingertips, toe tips. Imagining the ease spreading across your body. Take one last deep inhale, a long gentle exhale, and when you are ready, softly wiggle your fingers and gently open your eyes, carrying this calm with you. Gently open your eyes. Nicely warm your hands. Keep it on your eyes. And welcome back for the session. Hope you all had a good relaxing time. I request you all, if you did have a good relaxing time, kindly put it in the chat box. And I would also request our admin Shanmughapriya ma'am to share our Yoga Nidra session, which you can listen as and when possible, which would also give you a good relaxing sensation. And this music that was played was called as the bilateral music. I'll be speaking about it in the next part of the session. I can see a few responses. Okay, Meenakshi ma'am has told yes, she felt relaxed. So thank you so much, ma'am, for your answer. And again, going back to our session. So this was a body scan session. This you can do whenever you feel stressed. You feel that, yes, this might trigger an headache, or you already have an headache. You can try this body scan meditation. The other thing that you can try is called as a box breathing. Many of you might be aware of it, but still I'll inform you that you inhale, imagine like a box, okay? You inhale for 4 counts, you hold for 4 counts, you exhale for 4 counts, again hold for 4 counts. And you continue it in a cyclic manner like this for 10 times at least. So that also helps us. You can try it if this helps you or not. The other thing that, okay, sorry. The other thing that you can try is the warm hands technique. What you can do is you can nicely warm your hands. You can nicely rub it against each other. And once the palm are warm, whichever part is stressed, you can keep it at that part. If it is the jaws, if it is the eyebrows, if it is your scalp, or if it is your shoulders, you can nicely warm it and keep it on your shoulders or on your neck. Okay, this is called as the warm hands technique. There is another one technique which is called as the somatic experiencing technique. So in this technique, whenever you have an headache, what you can do is you can just calm yourself, okay? Sit in your room, and or preferably if you can go to a balcony or to a terrace where there will be better visibility, and that is, you will have more things to look at, more things to hear. You can go there and look at 3 things, hear 3 things, and feel. That is, you can touch the wall, maybe you can touch a flower or a leaf, maybe like that. You can feel 3 things, okay? And then you all must have had that 1 or 2 moments in your life which sets in like a picture, a happy place. Like for me, it was in my childhood in my hometown. We have a stream, okay, and the opposite side of the stream there were two very small, I will not even call them mountains, but very small mountains, and a very blue sky across it. And whenever I think of a happy time, that is the one picture that comes to my mind. Or you would have visited some place and you would have, that scenery you would have captured with your eyes. So imagine or recall that image, that place, that memory, and imagine yourself sitting in that place. Imagine you're looking at those things again. Imagine you are observing those things again. And let yourself be in that place for 2-3 minutes. And then definitely, slowly, when you feel that you are okay with it, you can ask yourself, sitting in that place, imagining you're still sitting in that place, and you can say, why do I feel the pressure or tension now? Can I, be in this moment rather than feeling that thing? Can I relax my body? And then you shift from your headache, from that pain of the headache, to that place where you imagine yourself to be. And once you feel you are a bit relaxed, allow your body to sign. You can yawn, or you can just stretch yourself, or you can just tremble yourself. Okay, so that way you can manage or distract your pain a little. So this is called as somatic experiencing. You are experiencing something even though you're not there. This usually works very well for headache. So I would recommend you to try that. The other one thing that you can try is writing down a few positive affirmations. Okay, if you are the kind type, you can say it's okay, I am having a headache now and my body needs kindness now. So I'll sleep, or I'll eat things I like, or I'll go out and watch something that I like. Okay. Or you can, if you're the fighter type, you can say that this headache is tough, but I'm tougher. I'm going to do all my work. Or you can say, I'm doing the best I can at this moment and I'll not push myself more. If you are the perfectionist type, you can tell this to yourself. Or you can be like, pain doesn't define me, I'm more than my headache. Or you can say, I can breathe through this discomfort with patience and care. I'll give myself time to overcome from this headache. So I'll take the rest, whatever is necessary. Okay, so many such affirmations are there. You can write down the affirmation that suits you the best. When you read that, you feel that you are vibing with it, you can definitely write it down. And whenever you have an headache, you can repeat it or write it down. Journaling your emotions also helps you overcome your headache. There is another one thing, many a times when we have headache, we feel that we don't have anyone for us. We feel that loneliness or isolation. So for that, there is one technique which is called as self-hug technique. Okay. So you can imagine yourself, the older version now, the current you, hugging the younger you. You all have seen your photos of childhood, right? You know how you looked when you were a child. Okay. So when you have this very bad headache and you feel this loneliness and isolation, you can just imagine and you can do this movement, as if you're hugging. You can do this action and you can imagine you are hugging the childhood self and you're telling it's okay, I'm there, you can rest. You can repeat these affirmations. You can give confidence to that younger self of you. That also you can try. Okay. And we heard about the bilateral beats. This is a type of music therapy that works very well for headache. So you need a headphone for this, preferably. And you can go and check out the in the YouTube. You have many such bilateral beats in different instruments. The one that I used was for drums. So once you hear with the headphones, sometime the sound will come from the right, sometime the sound will come from the left, and this alternating pattern usually gives a relaxation to you. Then there is also something called as the Tibetan singing bowls, uh, which is also called as the singing bowls. You can try it out. There are many such music in the YouTube, and you can try it out and see which one works for you the best. And the last part, there is something called as uh, digital toxicity. Okay. Whenever we have a visual fatigue, it also gives us headache, right? It leads to tension headache. When we have a cognitive overload, lots of thinking, this has to be done, that has to be done, that multitasking leads to mental fatigue, which is also a type of tension headache. Then we did not have a proper sleep because of, as Amuda ma'am was mentioning, and someone in the group also mentioned, poor melatonin release, right? And then there was some emotional overstimulation. Something happened that made you anxious or angry or grief stricken. When you have such things like constant notifications, recently when I heard that okay, Trump is going to send away students from Harvard back to India, I was like, okay, what will happen of my brother? And that constant notification was because I saw one thing, the constant notification was coming in my mobile, right? Then the blue rays, it did not allow me to sleep because of the melatonin release was bad. So when these things happen, there is something called as digital detox which you can follow. And this really works well, and it has worked well for many of the headaches. You start with a digital free hour. 1 hour when you will not touch your phone. Okay. Zero screen exposure, zero mobile exposure, zero laptop exposure. This lowers your cortisol levels. You can go for a walk, but don't take out the mobile and put it in your ears and say that I'm listening to music. No, no music, no mobile, no nothing, no laptop, no nothing for whole of 60 minutes. And this lowers the cortisol. Remember in the first slide I told you, and it calms the nervous system and prevents the morning tension, especially build up. Okay, the other thing is sensory break 3 times a day, morning, afternoon, evening, for 10 to 15 minutes. You are not going to look at anything from your laptop or your mobile. Nothing. 10 to 15 minutes. In fact, this was done in South Korea recently, where they said that, okay, we are going to have a sensory break day. Okay, so they invited people to participate for free, where you have to just sit and do nothing. Okay, they booked a whole big ground where people sat. You cannot eat, you cannot sleep, you cannot watch, you cannot draw, nothing. You just have to sit and look around. Trust me, within half an hour, the size of the population reduced to 25%. The whole big ground, everyone left, only 25% of the population was there. So you taking such, because nowadays we don't know what to do if the mobile is not there in my hand. If the laptop is not there, I don't know what to do. There was a time when I used to sit out of the window and just keep at look, like I used to keep looking at people. Now I'm not able to. When I was a child, I can, without any thinking, keep looking here, there, this, that. Now I'm not able to do it. My brain constantly needs stimulation. And for that, I hook on to my mobile or my laptop. Then notification cleanse. Okay, non-essential notification, turn it off for 3 days. Okay, leave aside 3 days. 1 day. This will clear your mental bandwidth. Too many overthinking thoughts. The multitasking that will get reduced. For multitasking, you can also have the one app rule. How many of you, when you use the laptop, you have multiple tabs open? Even I have it. Even right now, I have it. Right? Even on my mobile also, we'll keep switching between the tabs. Let us follow one app at a time rather than multitasking. I know it is difficult when it is a workspace, but other time when you are just going through your mobile, you don't need multiple apps open. Stick to one app. I'll watch Netflix, I'll watch Netflix, I'll watch Insta, I'll watch Insta. This will reduce the multitasking fatigue, which leads to the mental fatigue. And then the last one that you have is digital wind down. Usually 90 minutes before sleep, we advise everyone not to look at the mobile before this. There is no screen time. Rather replace it with warm compress, like Amda ma'am said, for your eyes, or soft, that is rose water compress for your eyes. Or you can also, have soft music, but not on mobile. You have those. It is called as the I don't know, JBC sound melons, or your, what is that? That is also one thing that is coming up. No, I always Sarigama Karwa. things like that. Listen music in that, or guided meditation in a radio, or you can put it in a pen drive and attach it to that sound melon or something and listen to the video. Then journaling the emotions before going to sleep also helps you overcome. So before I wind up the session, a very quick recap. First, observe whenever you have a headache, which part of your body muscle is getting constricted. Identify the trigger. What was the automatic thought? Address the automatic thought, follow the body relaxation, and keep doing it in a repeated pattern. You can use any of these relaxation techniques. Keep doing it every time so that your body is trained, your mind is trained in such a way that when immediately when you see a trigger, you are like, okay, if I follow it up with this too much, I'll get an headache. Okay, so with this, I'll end our session today. Before we stop the session, I would request all of you to put 3 takeaways that you are planning to take from today's webinar. And you can also provide us your valuable feedback in the link shared by our admin ma'am, so that it enables us to do our work better. We have also shared the our medical guidance and counseling numbers along with the naturopathy number. You have any further doubts, you want to ask us anything personally, you can get in touch with us.